Hello, happy Mother's Day to every woman watching this. Whether you're a mother, whether you're expecting your first child, whether you're a grandmother, whether you're someone who just loves women, happy Mother's Day. I welcome you to this very important conversation. Mother's Day in Nigeria is a beautiful occasion. It is a day we choose to honor our mothers, the people who has brought us into this world, the people who have nurtured us, the people who have sacrificed for us. We buy gifts, we celebrate, we cook jollof rice, we go to church, do Thanksgiving, then we take family photos. It is a day of joy. But today, wait, I want us to go deeper than all these celebrations. I want us to have an honest conversation about something that affects millions of Nigerian mothers but is rarely discussed openly. I am talking about cesarean section. I am talking about the stigma that surrounds it. In Nigerian communities, when a woman delivers with cesarean section, the reaction is not all pure joy. It is joy mixed with judgment. Congratulations, so next time you will push. Thank God you are alive, then somebody will not come. She didn't try enough. And on Mother's Day, when families gather, our mothers are also there. The women will now sit in silence, thinking of their own delivery. Then you hear some women start saying, I had natural deliveries, and they start giving stories with pride. This should not happen on any day, not on Mother's Day, and not on any day. Today, as a health educator, I want to break down this comprehensively. I want to explain to you what cesarean section is really all about, why it happens, what the recovery involves, and how families can offer better support, and why every mother deserves honor regardless of how her child arrived. This video is long. It's a very uncomfortable topic, but today we are going to learn together. Now let's start with the basics. What exactly is cesarean section? In simple terms, cesarean section, commonly known as C-section, is a surgical procedure used to deliver the baby through incisions made in the mother's abdomen. It is not a new procedure. It's been performed for centuries and centuries, but modern medicine has made it safer than it used to be. Now, here is something everyone should understand. A C-section is not an alternative to vaginal delivery. It's not because the women choose or because they are afraid of labor pain. No, in majority of the cases, it is a medical necessity. The doctors usually recommend cesarean section when vaginal delivery poses a risk to the mother, to the baby, or even to both of them. Now let me give you a real reason why cesarean section becomes a necessity. First, number one, prolonged or obstructed labor. This happens when the mother has been in labor for hours and hours, but the baby is not descending. In some cases, the baby's head is too big to pass through the mother's pelvis. Medically, it is called cephalopelvic disproportion. No matter the amount of pushing, it will not solve this problem, and continuous pushing only puts the mother and the baby at risk. 2. Abnormal positioning of the baby. Have you heard the word breech? Ideally, a baby should be facing head down, facing the mother's back. But sometimes the baby is in what we call breech. That's not that term breech, meaning their feet or buttocks are positioned to come out first. Delivering a breech baby vaginally is at risk because the head, which is the largest part, gets stuck after the body has been delivered, and this can lead to brain damage or even death of the baby. Third, placenta issues. Some women develop a condition in pregnancy called placenta previa, where the placenta covers the cervix. If such woman goes into labor, the placenta can tear away from the uterus, causing severe bleeding. and it can kill both mother and child within minutes, just a matter of minutes. 4. Fetal distress. During labor, the doctors continue to monitor the baby's heart rate. If the baby's heart rate drops significantly, it is not advisable to keep on pushing. It means the baby does not get enough oxygen, and every minute counts. A C-section becomes the easiest and fastest way to rescue that baby. 5. Maternal health conditions. Some women have preeclampsia, diabetes, heart condition, high blood pressure, and may not be able to withstand the stress of prolonged labor. A planned C-section protects their health. 6. Multiple pregnancies. Twins, triplets, quadruplets, or more, depending on the positions of the baby. Vaginal delivery may be too risky. 7. Previous C-section. Many women try to attempt VBAC, vaginal birth after delivery. Some are advised to have repeat cesarean sections based on the type of incisions they had or other risk factors. These are just few examples. The point is, if your doctor recommends cesarean section, it is not because they feel happy cutting you or they derive pleasure cutting you. It is because they have assessed the risk and determined that this surgery is the safest option. Now I want to talk about something, the easy way out. People who do not understand what cesarean section is call it the easy way out. Cesarean section is a major abdominal surgery. It is not just a small procedure. The woman has 7 layers of her body being cut. That is the skin, the muscles, the fascia, the peritoneum, the uterus. 7 layers. After which they stitch them back. And after the surgery, that mother is still expected to come and care for her newborn while recovering from this kind of operation. Ordinary appendix operation that some people go through, they are crying, they are in pain. Then imagine as a mother, after cesarean section, you still have to come and take care of that child. Let me walk you through what recovery looks like. The first 24 hours, the mother cannot eat solid food. She is on fluids. Why? She needs to pass her gas so that the doctors can confirm that her gastrointestinal system has started working properly before you take fluid or before you take food. She's on fluids. She's on IVs. She's on medications. She's often catheterized, that she has a catheter in her urethra because she cannot walk to the bathroom. The pain is significant. It is strong. Very strong. She's giving pain medication, maybe paracetamol or something stronger. It just dulls the pain for a minute or a while. After a while, it comes back and it does not go. It's not just erasable. You cannot just forget about it. Now, the first week, getting out of bed is a process. She has to roll up to one side, use one arm to push herself, keep her abdominal muscle completely relaxed because she doesn't want a situation whereby she will strain herself and pune. When she's walking, when she's about to cough, when she's about to even laugh, it is painful. She has to support her abdomen, support her own self, or else she will feel pain. Now let's talk about wound care. This incision, the cut, should be kept clean and dry. She has to watch out for signs of infection, which are redness, swelling, discharge, or even fever. Any of this means she has to go back to the hospital. Breastfeeding. Breastfeeding a newborn while recovering from cesarean surgery or abdominal surgery is challenging. You have to find the most comfortable position that does not put pressure on the incision. So you start doing trial and error. Most mothers need help even positioning the baby. Another one is you do not even lift. You are restricted from lifting. For about 6 to 8 weeks, you cannot lift anything. Anything heavier than your baby, it is not advised to lift. That means no carrying of even older children. Imagine you're a toddler and the toddler wants you to carry, but you can't lift because you cannot carry something or anything heavier than your baby. Now let's talk about the emotional recovery. Beyond the physical recovery, there's also the emotional aspect. Most women feel like they are disappointments. They have this sense of disappointment or failure because they could not have vaginal delivery. This feeling is usually reinforced by comments from family and friends. So when someone says cesarean section is easy, or CS is easy, or C-section is easy, they simply do not know what they are talking about. There's nothing easy about major surgery followed by newborn care. To address this stigma, what can we do? Why do Nigerians and many Africans look down on cesarean section? This is because of several reasons, and these reasons are deeply rooted in our culture. First of all, the value placed on natural processes. In traditional African homes or tribes or communities, there is a high value placed on things happening naturally. Childbirth is seen as a natural event that women's bodies are designed for. When it doesn't happen naturally, it raises question. What went wrong now? They don't see it as a medical decision or a medical necessity. No, they see it as a failure of the woman's body. Secondly, the connection between pain and value. In Nigeria, we believe that when you labor, or when you suffer, when you make that thing, or when you now get successful, you have value for that thing. In Nigerian cultures, there's a belief that the pain of childbirth is what makes you a real mother. The more you suffer, the more pain you suffer, or the more you labor, is the more you have earned your child. This is why you hear women saying, I've been in labor for 2 days. I don't want to have cesarean section. What will people think of me? No. That is why when you see women, I was in labor for 2 days. Agbah woman, now Agbah Bola and all, strong woman. Just so that you will not just do the cesarean section. When a woman has cesarean section, she avoids hours of labor pains. She has paid her dues. She has become a mother regardless of how the baby came out. Thirdly, spiritual and religious interpretation. Nigeria is a very religious country. We like religion. Where? Many people interpret this event as spiritual problem. It is a sign of spiritual problem. They've cursed her or they've tied her womb. That is why she's giving birth through operation. The operating table is seen as devil's workshop. So rather than modern medicine saving life, no, it is problem. CS is cause. It isn't. Number 4, economic factor. Now this is where it affects a lot of people. It affects a lot of families. It is expensive. In a community and in a country where people pay out of pocket, the cost is significant. When a family spends large amounts on cesarean section, imagine the outcome is not perfect. There could be resentment. When the outcome is good, the expense could be a talking point. She cost us so much money, and it becomes part of her story. 5, misinformation. Many older women in our families have never been educated about why cesarean section is necessary. They only rely on their own experience. I gave birth to 10 children without operation in my house. I am fine. They say they do not understand that their own births could have ended up badly if a complication had arisen. They project all their experiences onto young women and judge them for not doing same. 6th, the role of extended family. In Nigeria, childbirth is not just between the husband and wife. It involves the entire family. Mothers, aunties, sisters, cousins. Everybody get opinion about how you won't give birth to your own pikin. When a woman is in labor, make sure your wife push well, not let them cut her. This pressure can actually override medical advice and put lives at risk. Understanding this helps us see that the stigma is not just ignorance. It is about a cultural, spiritual, economic, and social problem. And changing it requires addressing all these layers. When we talk about stigma, we talk about what it does to the women. It is not just about, you hurt my feelings. No. It is about real measurable harm. Let's talk about the psychological impact. Many women who have had cesarean section experience what psychologists call birth trauma. They go through a medical event. Instead of being supportive or being supported, they are being judged. This can lead to postpartum depression, it can lead to anxiety, it could lead to feelings of inadequacy. Some women even struggle to bond with their babies because they feel they failed them. Then they now hear whispers like, oh, she not be real mama, she not be this, she not be that. Then they will internalize them. Another thing that the stigma causes is delayed healthcare seeking. Because of the stigma, many pregnant women delay going to the hospital when they know something is wrong. They've been laboring for days and days, but they do not want to go to the hospital because they are afraid that if they go early, the doctor might recommend a C-section. They'll rather stay at home hoping for a miracle rather than facing the judgments of their own family. That delay could be fatal. By the time they get to the hospital, it may be too late. Then now the stigma also puts pressure on healthcare providers. Doctors and nurses feel enormous pressure from family to avoid cesarean sections. They are accused of recommending surgery just to make money. Some families even threaten doctors because they recommended cesarean section. And this pressure can lead to a dangerous delay. And this delay can be fatal. Now, marital stress. Some husbands are influenced by their family. Walai talai. Some husbands are influenced by their families. They start to blame their wife for the cesarean section that they are having. Some people may even withdraw emotionally. They make comments that make the woman now feel like, oh, she's less than. In extreme cases, these marriages suffer long-term damages because the husband cannot understand that the cesarean section was a medical necessity and he sees his wife as only a failure. Another thing is social isolation. When women have cesarean sections, they withdraw from social gatherings because, they're tired of the questions like, how was the delivery? How was it? Because if they tell the truth, they will judge them. Look at them, you know, be Hebrew woman. So the most times we just stay at home. They miss out on community support that the new mothers need. In the reality, this stigma does not just hurt feelings, it harms mental health, it endangers life, it breaks family, and it isolates women when they need this connection the most. Now I want to speak to families and people around mothers. The husbands, the parents, the in-laws, the friends, the neighbors, because you have a role to play in ending this stigma. To the husbands, when your wife is in labor and the doctor says she needs a cesarean section, your response matters more than you know. You may have calls coming in from your family members, your village people, telling you, in our family, women don't do cesarean section. Women, they do operations to born pikin. Everybody has their own opinion, but in that moment, you are the one that will sign the consent form. You are the one who must tell your wife, it is okay. We will do what the doctor says, and I am with you. Do not let family pressure delay a life-saving decision. Every minute you spend on the phone debating with your village people, your wife and your child are at risk. After the delivery, you will not thank her. Tell her, not just for the baby, for even this surgery, for the scar, for the recovery that she will go through. Tell her you are proud of her, and those words will heal her more than you know. And to the mother-in-laws, aunties, uncles, family members, I greet you with respect. You have raised children, you have experiences, but I ask you to consider that medicine has advanced since you had your babies. Complications that would have killed a woman 50 years ago can no longer kill her because it is now managed with surgery. So when your daughter or your daughter-in-law says, oh, I'm going to have a cesarean section. Don't say in our time we delivered at home. Don't say why. Don't say next time you must push, or in our family we don't do CS. Instead, say thank God you are alive. Thank God my grandchild is here. Rest, you have done well. Your blessing alone means more than you know, or more than you realize. To extended family members and friends, when you visit a new mother that just had a cesarean section, watch your words. Do not start asking, make I see your scar. It dey pain? How the thing they feel? No. Why did they cut you? No, don't ask those kind of questions. She may not even know why they cut her. She might not understand the medical reasons. She might still be processing it. Do not share stories of, you remember Mama Ejima that was pregnant with you that last time now? She gave birth, she not do CS, now vagina he used born. No. Do not share these stories with women as if you are shaming them. Instead, ask, how are you feeling? How can I help you? Offer to cook, to clean, to help watch the baby so she can sleep. Practical support means more than commentary, more than talking. And to us in general, to the community, we should normalize C-section as a valid way to give birth. We must stop seeing it as a failure. When you hear someone say negative things about cesarean section or a mother that has gone through this, firmly correct them and say she had surgery to take care of her life, to save her baby, and that takes courage. We must advocate for a stricter education, for better education in our schools, in our churches, in the mosque, and about maternal health. The more people understand, the less they will judge. Now, after cesarean section, what next? Future pregnancies. A common question I get about women who have had cesarean section about future pregnancies are, can I have more children? Can I ever have a vaginal delivery? Let me tell you, first, having a C-section does not mean you cannot have more children. Many women go on to have multiple children after a cesarean section. The key is spacing your pregnancy. Most doctors recommend waiting at least 18 to 24 months before getting pregnant again. This gives your body, especially your uterus, time to heal fully. Secondly, vaginal birth after cesarean section, VBAC. It is possible for some women. Whether you can attempt VBAC depends on several factors. The kind of incision you had. If you had a low transverse incision, that is the one that is horizontal, then you may be a candidate for a cesarean section. But if you had the long vertical incision, you may not be a candidate. The reason for your first cesarean section also matters. If it is something that is unlikely to repeat, like a breech baby, VBAC may be possible. If it was because of a permanently small pelvis, it may not be possible. If it was because of medical conditions that happened in your first pregnancy, it may or may not be possible. Your doctor will assess your specific situation and advise you. Some women have VBAC, some do not, but both are valid. Thirdly, each pregnancy is different. Even if you had a cesarean section before, even if you had a CS before, your next pregnancy will be monitored carefully. You will need to pay more attention to your own body. You may have frequent checkups. Your doctor may pay attention to the position of your placenta, to the size of your baby, and the health of your uterine scar. The goal is always healthy mother, healthy baby. Here is a comprehensive guide to supporting a cesarean section mother, a woman who has just had CS or is about to have one. Here is a practical guide on how you can support her. Before the delivery, if the cesarean section is planned, that is scheduled, offer emotional support. Ask her, how are you feeling? Listen to all her fears. Help her prepare the house for recovery. Help stock up on groceries. Prepare a comfortable space where she can rest with the baby nearby. At the hospital, if you are allowed to be fully present, follow hospital rules. Bring things that she might need, maybe a long phone charger, comfortable clothes, toiletries. Most importantly, be calm. Your calmness will help her stay calm. When she returns home, this is where she needs help the most. Offer to cook, offer to clean, offer to help her watch the baby so she can rest. If she has other children, help with them. Practical help is the love a cesarean section woman needs. Practical help is love in action. Emotional support. Check on her mental health. Ask her how she's doing. If she seems withdrawn or tearful, encourage her to speak to a healthcare provider. Postpartum depression is real and treatable. Now, respect her boundaries. She may not want visitors immediately. She may not want to talk about the delivery. Respect that and let her heal at her own pace. Celebrate her. On Mother's Day, on her birthday, ordinary days, celebrate her. Remind her she is a wonderful mother. Remind her that her children or her child is lucky to have her. Now let's talk about a big picture. Nigeria has one of the highest maternal mortality rates in the world. According to global health estimates, many women die each year from complications related to pregnancy and childbirth. Many of these deaths are preventable. One of the reasons is because women do not have access to timely medical care. They delay going to the hospital. They delay agreeing to life-saving interventions like cesarean section. They listen to family members who say do not let them cut you. Every delay increases the risk. When we stigmatize cesarean section, we are not just hurting feelings, we are contributing to the culture that puts women at risk. Yeah, we're telling women that the method of delivery matters more than their own life. This must change. We must create a culture where women feel empowered to seek medical help without shame, where families support medical decisions, where doctors can recommend cesarean section without being accused of greed. This is not just about women, it is the future of our children. Healthy mothers raise healthy children. Healthy children become healthy adults who contribute to society. Investing in maternal health, including normalizing cesarean section, is investing in Nigerians' future. As we come to the end of this conversation, I want to leave you with some thoughts. Mother's Day is a time of celebration, but let us make sure we are celebrating all mothers, not just the one that gave birth in a certain kind of natural way, not the ones who tell dramatic stories of pushing. All mothers are mothers. The mother who had cesarean section, the mother who had 2 days of labor, the mother who had a planned cesarean section because her baby was breech, the mother who had an emergency C-section because things could have gone wrong. Celebrate them. The mother who had a cesarean section and later had vaginal delivery. Celebrate her. My name is Vanessa and I am committed to health education that makes a difference. Subscribe to this channel if you want more content like this, and remember, every mother matters. Happy Mother's Day.